Thanks for joining us for this COVID-19 and City News briefing for Thursday, December 10th. We will try this again. We're having some technical difficulties. In the hospital today, we have 98 people who are COVID positive between Merit Health Wesley and Forest General. That's 3, and we have another 3 under investigation right now. And of those 98, we have 33 who are in the ICU. Again, that's total between our 2 hospitals. We got as high as 109 yesterday, which is a really high number. And while we've come down to under 100 now, we're still in some very dangerous territory as it relates to having capacity to take care of people as we move forward. Statewide today, we added 2,283 new cases with 42 new deaths, and unfortunately, one of those new deaths was in Lamar County. We send our thoughts and condolences to that family, but as of now, Forest County's total deaths from COVID, 90, and Lamar County at 51. New positive cases today, Forest County had 62 new positive cases, Lamar County had 45, and this 107 number is a really high number for our metro area, and so again, not boding well for us going forward. Totals to date, 4,319 in Forest County, Lamar County, 3,322. Our 5-day average was up to 90 a couple of days ago. We had a couple of days where those new positives kind of came down, brought that average down, but now we're back up to nearly 80 again. Our inside 14-day number, this is the number of people who have received their positive test result, and this is a very significant number as well. Forest County's inside 14-day potential active cases now stands at 569, and Lamar County's now stands at 459. As you can see, we're adding new lines to this graph, and we don't want to, but now we have crossed the 1,000 threshold for the number of people who have received their positive test result in the last 2 weeks. So bottom line is the Hattiesburg metro area now has more potential COVID cases than at any point thus far in this pandemic. And it stands to reason that as that number goes up, the more people that we have who are sick, the more we're going to see more spread, the more that we're going to see end up in the hospital or in the ICU or worse. Just compared to a week ago, last Wednesday, Forest County's inside 14-day number, again, potential active cases at 484, it now stands at 569, and Lamar County's jumped from 419 to 459, so an increase of just over 1,000 active cases in 1 week's time. In the hospital, an increase again, 93 to 98, and ICU admissions stayed even at 33. Our goals continue to be the same: try and protect the vulnerable, people who are over the age of 60, people with underlying or chronic health conditions, and also try to prevent overrun of the healthcare system by slowing the spread and prioritizing public health while giving the private sector the space to operate. Speaking of capacity in the healthcare system, as of this morning, when the day started, Forest General had 11 acute beds available and 1 ICU bed available. Merit Health Wesley had 8 acute beds available and 2 ICU beds available. Now, the one thing that we always say with hospital capacity is you'll start the day at one amount with a certain number of beds available, and then the hospital will typically discharge. In the case of Forest General, between 80, 100, sometimes over 100 people in the day. Merit Health Wesley also discharges a lot. But then in the afternoon comes, you have people coming in from surgeries, you have people coming in from the emergency room, and that number goes back up. And so as we get closer to the 5 and 6 o'clock hour, that capacity will tighten once again, and we'll see kind of where we stand tomorrow morning. The 4 things that we lean on to try and achieve our goals of slowing the spread on this thing is making sure there's widespread availability of testing, which we'll go over in a second, wearing masks, watching our own data, listening to all voices. And yesterday we had our weekly conference call that we have every Wednesday with our school districts, our universities, both our hospitals, Hattiesburg Clinic, our local governments, and our emergency management personnel. And here are just some snapshots from data that we heard. The positivity rate, the positivity rate is the percentage of total tests that come back positive. First of all, we're seeing more people getting tested than we have at any point during this thing. But what we're seeing is the positivity rate is still up there. And so the week of November 22nd, the week of November 29th, we saw kind of the high point in positivity rate since this pandemic began, and that was at 16.3%. 3 days into this week, we're at 14.7%, but again, there are hundreds of tests that are currently pending, so that number could fluctuate even more. Another thing we look at is the percentage of new cases under the age of 20. We don't want anyone to get COVID. However, what we have seen is people who are younger typically, not always, but typically have an easier time with getting over it than your older populations. And so if you look back to the week of October 11th, when we had another sort of smaller spike, the good news is that 30% of those were under the age of 20, and so you didn't see that spike translate into new hospitalizations and ICU admissions and deaths. However, what we're seeing now is that percentage of cases under the age of 20 has gone down, and so this week, for example, we're at 13.5%, a far cry from the 30% back in October. And so what this means is the average age is going to go up, as you can see in this next slide. Back in that week of October 11th, the average age of new positives was 36.5, and so you didn't see that translate into hospitalizations and ICU, but now you're seeing in the mid-40s. So the week of November 22nd, it was 46.3, which was kind of a high water mark. Last week was 44.4, but already this week, 3 days in, the average age is already 46.6, which would set a new high water mark for that. That means that a lot of people who are getting this disease are going to end up in the hospital, just because we know that older people typically have a tougher time getting over it. But where are these active cases coming from? We look at our emergency management personnel to kind of let us know in what geographic area we have people that are inside their isolation date. That means waiting for their from the onset of symptoms, the number of days that need to pass until they are considered free and clear of COVID. In Hattiesburg right now, that number stands at 250, which is an increase of 75 from last week. The unincorporated parts of Forest County, that's areas outside of Petal, South Forest County, that kind of thing, 136, that's an increase of 32 from last week. Petal is actually down only 57 of those cases right now, and then USM stayed even at 21, and mostly those are student athletes who have been diagnosed with COVID. William Carey with 0 active cases right now. Yesterday, Governor Reeves also issued executive orders. Not a lot changed for us, but he did limit high school sporting indoor events to 4 people per player, or 250 people, whichever is greater. Limits college indoor sports to 1,000 spectators. Of course, he held the mask orders for places like Forest and Lamar counties, for the entire counties, not just Hattiesburg. It also limited gatherings to 10 indoors and 50 outdoors, and continued all other restrictions, and that runs until early January. The bottom line of yesterday's conference call, and the bottom line from what we're seeing today, is we are in a tough stretch, and that stretch will likely continue. We know that hospitals are being stretched, and I know that there are conversations going on about how we preserve capacity for what is likely going to continue to be an increase in COVID cases, both in Thanksgiving and Christmas holidays. But there are things that we can do if we all do them: wearing a mask, practicing social distancing, avoiding unnecessary gatherings. We know right now that wherever you go, if there are any number of people there, you're likely going to have someone in the crowd that may have COVID and may be asymptomatic. That's just the nature of where we are when you have 1,000 active cases in Forest and Lamar counties. Wherever you go, you may have someone there who has COVID unknowingly. So do your part. Wear a mask, practice social distancing, and avoid unnecessary gatherings. Testing opportunities, we want to make sure during the spike that you know where you can go to get tested. So tomorrow and Friday, you can go to the Cough and Fever Clinic on 49 South, that's 8 to 4. All of Merit Health Wesley's outpatient clinics will be open 8 to 5. The C.U. Wood Community Center will be open again tomorrow morning from 8 to noon. Forest County Health Department will have drive-up testing from 11 to 6 at their facility on the 42 bypass. Of course, you need to go to covidschedule.umc.edu to register for that and answer a few screening questions. And there's still another hour to go out to Purvis and go through the Lamar County Health Department's drive-up testing. That'll run until 6 o'clock. Some city news today. Yesterday, we announced the transition plan for our police department. Of course, Chief Parker is stepping down at the end of this year and earning a well-deserved retirement. And what we have decided to do is Assistant Chief Peggy Seeley will assume all the duties of the chief's position for the rest of this term, and Major of Operations Hardy Sims will assume all of the duties of the Assistant Chief's position for the rest of this term. Both of them very well qualified. Both of them came through the same academy class. Both of them believe and live community policing, and we look forward to all they will accomplish over the next few months. Also, paving has continued this week. We are on East 7th Street in the Mobile Bowie neighborhood. East 7th Street should be wrapped up by tomorrow. Again, as we continue this week, remember to wash your hands, take care of yourself mentally and physically. Wear a mask if you're out in public. Do only what is essential. And remember, especially right now, you are safer at home. Have a good evening.